This conference will now be recorded.
Okay. Hi everyone. Just to introduce myself, good morning. My name is Dr. Bhavna Sharma. I work as a medical registrar in London and I specialize in endocrinology. As a part of the teacher team, I basically am part of the medical side of the OET teacher team. And what we've tried to do on this session is that I've tried to just highlight what small and capital letters do in terms of medical English on your OET. The OET exam is a little bit tricky because what they're trying to assess is basically what they call medical English. So they want you to be accurate in terms of your communication, clinical communication skills, both written as well as verbal, if we're talking about speaking. But they also want to look at the nuances of grammar, which often get very tricky because these are things that were not taught in medical school specifically. But then all of a sudden, you're supposed to give this English exam and you're looking at things like whether you're capitalizing the thing at the right point or you're writing medications correctly, which is again not something that we learned in medical school or even during our post-graduation or even more senior roles. So this is a very common mistake which students do make on their OET, which is just trying to differentiate between when to use a small letter and when to use a capital letter when you're talking about various points on your OET writing. This is assessed, unfortunately, and a lot of students, they lose out marks, which are quite easy to get back. So things like spellings and things like verb forms and articles, they're a little bit more tricky because you have to memorize, you have to know about the concepts, and you have to know how to apply the concepts in different forms of sentences when you're trying to paraphrase. Now, small and capital letters is a little bit easier, so I like that. It's an easily correctable mistake. So if you understand the basic points, that increases your grammar score quite rapidly. So hopefully, after today's session, we'll have a beneficial effect on the students, and they'll be able to increase their grammar score on the OET writing quite rapidly. Okay. So what we're going to talk today is medical English, where to use small letters and where to use capital letters. So let's just start. Guys, when you're starting a sentence, this sounds very, very simplistic, but it's actually quite important. When you're starting a sentence or you've got a full stop, the full stop is always going to be followed by a capital letter. I can't tell you how many students make this mistake, especially when they get nervous on the OET writing. All sentences, they have to begin with a capital letter. This also becomes confusing when your sentences aren't very nicely constructed. So the examiner can't make out where you put in a full stop. So always when you finish your sentence, full stop, leave a little bit of space. Make sure that the examiner is able to figure out that you're now starting a new sentence, and the new sentence is always going to start with a capital letter. Very, very important and very, very easily correctable mistake. Next thing, guys, when you're talking about a patient, it's a proper noun. So it's always going to start with a capital letter. So the capital letter will be both for the patient's salutation. So if they're a miss, a mister, a master, then it's always going to start with a capital M. And the patient's name itself, the first name, as well as the surname, both are going to be capital letters. Okay, so Mrs. Smith came to the hospital complaining of whatever she came in complaining of. I have referred June. So this is not the month June. It's the name of a patient who's called June. So I have referred June to the hospital. Another thing, guys, please make sure when you're starting your actual letter and you're referring to the patient's full name, it's going to be Mr. M is going to be capital. The J in the Jack is going to be capital. The S in the Spencer is going to be capital. And then full stop. And then the date of birth is going, if you want to write it in that format, all of these things have to be in capital as well. So DOB will be in capital. So this is also a very, very easily correctable mistake that students make on their exam. Now, medications. Loads of students, they have this problem. We keep on asking this question again and again. It keeps cropping up on our YouTube comments as well. Guys, generic medications are going to start with small letters. So metformin, atorvastatin, aspirin, paracetamol, all of these are going to be in small letters. Brand names, for example, Humulin M3, Act Rapid, Nova Rapid, they're all brand names. So they, what basically brand name means, lots of students who might work in South Asian countries might understand this, or even in Western countries. When you prescribe a medication, you can either prescribe it as a generic medication. So when the patient takes that prescription to a pharmacy or a pharmacist or a chemist, they will look at whatever the generic medication name is, and they might give the patient a number of different medications from different companies, but who's got the formulation of what you've asked for. Or they might give a government supply, which is just going to be that particular medication if it's not coming from a particular company. Brand names are when you prescribe a medication and that medication is taken to a chemist. They'll have to give your patient that particular medication from a specific company. So if it's from a specific company, it's going to start with a capital letter. So Humulin M3, Act Rapid, Nova Rapid, Aliquis, Xanax. They're just some examples of brand names of medications which often crop up on your OET. Let's just see this extract as to how we would use this on an actual OET letter. So her medication, notice that H is capital because we're starting a sentence. Her medication included metformin. So metformin, the M is going to be a small one, and glipizide is going to be a small one as well. And then he said I instituted, so the I is capital because we're starting a sentence. Atacant, so Atacant is a brand name, so that's why it's going to start with a capital letter. So very, very important that we understand this concept. Guys, this question has been asked so many times to us about the brand names and the generic names. So hopefully after this session, no one's going to make this mistake again. Now, whenever you're talking about hospital names, the hospital name is also a proper noun, and you always have to start it with a capital letter. So make sure when you're saying that I referred the patient to King's College Hospital, the K is capital. Sometimes you can also even put the H in a capital as well, but that's a minor thing and it varies across countries, so I won't really worry about it. But definitely, uniformly across the board, the name of the hospital has to be in capital letters. Acronyms. When you're talking about a patient undergoing some investigations like MRI or CT scan, the CT and a MRI has to be all in capital letters. And X-ray, So X-ray also varies with countries, but definitely the X has to be capital. The R may or may not be capital. That's another minor thing, which again varies. But definitely, whenever you're talking about investigations which are acronyms, the first letter has to definitely be a capital. If guys, if you don't know the full form on your OET and you want to mention something, for example, MDT, if you don't know, that stands for multidisciplinary team, you would have to put that in capital as well. And things like GFR, so the glomerular filtration rate, if you don't want to use the full form, you still have to put that in capitals. Things like HbA1c, because that's also an acronym which can be expanded, it still has to begin with a capital letter. So that's very, very important that we notice that. And this I've already mentioned. Date of birth, if you want to DOB, everything has to be in a capital letter. Let's just look at this sentence. A pathology report received on the date showed HbA1c levels of 10% and a GFR greater than 60 mils per minute. Her cholesterol was high. So just notice that cholesterol, we'll put that in small letters because that was an investigation, but it's not an acronym. So it's not a short form, it's a full form. So that's why it's in small letters. But HbA1c and GFR, which are also investigations, but they are short forms of investigations, are in capital letters. Guys, it's very, very important that you don't make these silly mistakes on your OET. If you have any doubts, please feel free to just stop me and I'll answer all of your questions. I don't want all of students to keep making this mistake again and again. And I don't want good doctors and good nurses not to make it on OET because of silly rules. So if you have any questions at any point, please type into the chat window and I'll stop talking and I'll answer your questions. Okay, so that was about acronyms. Guys, if you've understood everything till now, please type in yes into the chat window and then we'll move on to the next thing. Okay, good. At least we have got people paying attention. All right. So that was about acronyms and how they appear on the OET. All the titles that you write, especially when you're writing the address at the top of your letter, it's going to start with capital letters. Notice this um, from the official OET solved letters. The address, they've written everything in capitals. So occupational therapist, Old Meets Extended Care Center. So notice all of the letters start with capital letters. 13 River Street, Old Meadows. So everything in your address is going to start with a capital letter. If you're referring to a particular occupational therapist, so you're writing the letter to a particular person who holds that designation, then that's again going to be in all capital letters. So, dear occupational therapist, notice that the O is capital and the T is capital because you're writing to a particular person who holds that designation. So if you're writing dear, whatever the title is, it's going to be in capitals. So dear medical registrar, so that's going to be M capital and R capital. Dear chief nurse, so that's going to be C capital, N capital. Dear head of department, so that's going to be an H capital. The O doesn't need to be a capital, but the D is a capital here. And we've discussed occupational therapist. District nurse, to the capital, D capital, and nurse, it just depends on country to country. It may or may not be capital. Now that we've discussed this, let's look at the extract from the official OET soft letter. So they've talked about an incident where where there's one person who's the chief radiographer who's writing the letter, and he's talking about various other radiographers on the letter. So unfortunately, so this was the starting of a sentence, so it was a capital letter, comma, the theater case, because this is a comma and it's not a full stop. You don't need to make the T a capital here. The theater case was delayed until 2:30 and the radiographer. So this is a general term. This may or may not be a specific person, and the radiographer was not able to leave the theater. So in this case, this is not a capital letter. So this is talking about a general person. So that's why it's not talking about a specific position. It's more an occupation. And that's why this is not going to be a capital letter. So there's a difference between title and occupation. A title is a post that you hold. Okay, so you are a doctor, but you hold the post of head of department. You are an occupational therapist, but you are holding the post of a head of department. You are a nurse, but you're holding a post of a chief nurse. So in that case, that's the title. So the title is going to be in capital. But when we're writing to a particular person, starting an OET letter, in that case, it's definitely going to start with capital letters. So a cheat sheet, if you're writing dear, whatever the person is, start with capital letters. But in the actual body of the letter, if we're just talking about an occupation, for example, the radiographer, the nurse, then in that case, it doesn't have to be capital letters because it's an occupation. Okay. Then he talks about himself as chief radiographer. Now, this is the title of the person, the post that he holds. So that's why he's put that into capital letters. As chief radiographer, the C is capital and the R is capital, comma. Now, this is an I. We're going to discuss this again, but I's are always in capital letters. So this was followed by a comma, but still the I was capital. In the previous sentence, unfortunately, comma, this is not an I and there is no full stop here. That's why the T wasn't a capital here. So as chief radiographer, I have been asked by Dr. Quirk. So this is a proper noun, so that's why he put that into capitals. To investigate the circumstances surrounding the delay in response to the ICU request. So because it's a short form, ICU stands for intensive care unit, because it's a short form and you're not doing the whole thing. That's why the ICU is capital. On Saturday. So Saturday is a day of a week. So days of weeks have to be in capitals as well. Comma, 1st February. So February is also a month. So months and days are also going to be in capital letters. Full stop. Calling in the on-call radiographer. So this is also a new sentence. So the C is capital. Calling in the on-call radiographer. So this is also a job that they're doing. It's not a title. So you become an on-call radiographer for a day, but it's not your title. You don't remain the on-call radiographer throughout your life, but you can remain a head of department throughout your life. So that's why this again is not in capital letters. Calling in the on-call radiographer was not considered, as our policy states they must be provided 45 minutes prior to arrival at the hospital. Okay, so the H may or may not be capital here. So what did we learn here? Titles like medical registrar, district nurse, chief nurse, head of department have to be in capitals. All the words in an address have to be capitals. When you're writing to someone in particular who holds that designation, then that has to be capital. So, dear occupational therapist, dear medical registrar, dear chief nurse, everything is going to start with a capital letter. All months and all days are going to be in capital letters. If it's something followed by a comma, then it doesn't necessarily need to be a capital letter. If you're talking about a particular person and you're referring to them by name, then that's also going to be in capital letters. If you're talking about a particular person in a particular job, then that again doesn't have to be in capital letters. Guys, this is a lot of information, but this is information which makes you pass or fail on the OET, especially if you're at the borderline. So if you have any doubts, please ask now, and then I'll move on to the next thing. So if you've understood everything, please type in yes, and then we'll move on. Otherwise, if you have any doubts, I'm happy to answer them now. Okay, excellent. Now, one thing which is again quite important and quite commonly missed on your OET, when you're ending your letter, the Y has to be capital, but the F may or may not be capital if you're writing faithfully or sincerely. But definitely the Y has to be a capital. When you're writing your designation at the end of your letter, so at the beginning and at the end, we're going to be using capital letters. So occupational therapist, the O and T are capital. This is at the end, okay? So yours sincerely, comma, and then occupational therapist, the O and T have to be capital. And if you're a doctor and you're ending your letter with a doctor, the D has to be capital as well. Okay, Irene, if you look at this extract from the official OET, after unfortunately, they haven't put in a capital letter. Now, Mr. Manoj has covered all of the connectors in detail. If you're still confused about which connectors you use capital letters with and which you don't use capital letters with, I would strongly suggest that go to our official OET channel on YouTube, which is by the name of Teach You Academy. You should be able to go through all the connectors on the OET, and Mr. Manoj has covered everything in a lot of detail as to where you have to use capital letters in association with connectors. But the short answer to your question, you shouldn't always write a capital letter after a comma. It just depends on the context. Okay. Yes, Gabby, the second name should be in capital letters as well. Okay. One more thing which is very, very commonly messed up on the OET is when we're talking about diseases. Okay. Let's just see this extract. The D is capital here because we're starting a sentence. Thank you for seeing Mrs. Priya Sharma. So the M is capital, the P is capital, the S is capital, comma, a type 2 diabetic. Notice that the D doesn't necessarily need to be a capital because this is a common name for a disease for further management of blood sugar levels. Mrs. Sharma was diagnosed with, so they've written non-insulin dependent diabetes mellitus, but they've written that in short forms. So notice that everything is in all capital here. In 1999, full stop. Because it's a full stop, then this she is going to be capital. She has been monitoring her BP. So because this is a short form, then that's going to be in capital as well. And sugar levels at home since then. She has a strong family history of diabetes. So diabetes is again a common name. So that's why it's going to be in small letters and is allergic to penicillin. So because this is a generic medication, this is going to be in small letters. Another sentence. Mr. Lionel Ramamurthy was admitted on 4th February. So because it is a month, then that's going to again start with a capital letter. 4th February 2019, having contracted pneumonia. So pneumonia is also a common letter. So that's why it's going to start with a small one. Now, I appreciate your referral of 6-year-old Connor Mills. So Connor Mills is a first name and a second name. So that's going to be a small and a capital letter. Who exhibits signs of childhood apraxia of speech without obvious cause. So because this isn't a name of a specific disease, if they would have said that this is a specific disease, for example, they've got like a lysosomal storage disorder, or they've got something like Lewy body dementia, Huntington's chorea, they're all proper names of diseases which are named after the person who discovered them or the place where it was discovered. So because it's a proper name, then that's going to start with a capital letter. An example of this is Mrs. Jones is known to have Alzheimer's disease since 10 years. So because it's a proper name for a disease, then that's why the A has to be a capital here. So Shivani, it doesn't really matter if you want to put in a spacing line after yours sincerely or faithfully, but Shivani, please notice that you again put your Y as a small. On your OET, you have to write Y capital. So yours sincerely, comma, and then the next line, you can write doctor or you can write nurse, depending upon whoever's writing the letter. It doesn't really matter whether you leave one line or not. Okay. So we always give importance to us, and English is also the same. Whenever you're using the term I, it's always going to start with a capital letter. So that has been discussed before. Now, this is again an exception. When you're talking about therapies that you want to provide the patient, then that's also going to be in all capital letters. The patient would need a referral to cognitive behavioral therapy. Now notice that I've then put in CBT in all capital letters because that's an acronym. The patient would need to be seen by occupational therapy, and occupational therapy assessment may also be warranted for his coordination and writing difficulties. So again, this is something which is quite unique to the OET and something that you might not be familiar with in your day-to-day life. But when you're talking about therapies, you have to use capital letters. Okay, so that was it for today. It was a very short session, but a very, very important session on OET writing and the use of small and capital letters on your OET writing. Guys, if you're confused about connectors on OET writing, please make sure that you go to our YouTube channel, which is by the name of Teach Your Academy, and you should be able to find all of our previous sessions. We've covered connectors in detail. We've covered all grammar topics in detail on our YouTube channel. So make sure that you go and have a watch. And this session will also be uploaded on YouTube just to make sure that everybody's able to revise and go back to things when they're actually attempting their OET. If you want to enroll for our writing and speaking checks, which are the only writing checks which are done by a medical professional as well as an English teacher. I would strongly advise you to visit our website, which is www.teachyouracademy.com, and you should enroll for our speaking and writing checks, and they would help you out a lot because the feedback that we give is based on each and every OET speaking and writing criteria. And we also give you a study plan and provide you with good study material which is needed. You can WhatsApp us on the number provided in case you have any doubts or any questions, and mail us on on teachacademy@gmail.com if you have any questions with regards to our online speaking and writing checks. Okay, so Kalpana has asked that she's confused about medications. Okay, Kalpana, this is actually the most important part of today's session. So when you have generic names, which are not brand names, then you're going to be using small letters. If you're talking about brand names, which are medications manufactured by a specific company, then that's going to be in capital letters. Kalpana, take a screenshot of this slide, and when you're writing your OET letter or practicing your OET letters, just refer back to this screenshot. All the generic medications, small letters, all the brand names in capital letters. Good job. Shivani, so all countries, they vary in definitions of who is counted as a child and who is counted as an adolescent and who is counted as an adult. Usually they should give you a salutation on the OET writing. So they'll give you Connor Johnson, and then in brackets they'll give you Mr. or Master. I would advise for exact 18 years in any country that counts as an adult. So Mr. should be the right one. Jency just wants to see the last slide. So Jency, if you want to see this slide, you can take a screenshot of this. This is when you're talking about therapies. That's when we're going to be putting in capital letters. You can take a screenshot of this if you want. And if you just want to visit our website, all the contact details are here. Erin, I didn't really understand your question. If you can just elaborate on that. Okay. I'll just quickly mention, guys, if someone is telling you that they're going to book a group discount for you, the official OET guidelines have suspended group discounts till December. So they're not going to accept any group discounts till December. So make sure that you are a little careful about people who are offering you group discounts at present. So Shivani, when we're talking about diagnostic tests, let's just look at this sentence. So when you have short forms like HbA1c and GFR, that's going to be in capitals. If you've got results which are in full forms like pathology report or cholesterol, that's going to be in small letters. If it was, for example, it was HB and you were writing hemoglobin like HB, then that's going to be a capital letter. And if you're writing the whole thing, which is hemoglobin, then that's going to be starting with a small letter. That being said, if you're talking about MRIs and CT scans, because they're always written in short forms, they're both going to be in capital letters. Kalpana, if you don't know whether it's a generic name or a brand name, then a good strategy is that you just copy the case notes. Okay, excellent. So Deep has asked about how do we write name before the date of birth. So you can do both of the things, Adeep. The official OET solve letters even have different variations of how they present it. But to not get confused, just copy this one, take a screenshot of this. This is again from the official OET. Just use this and just get done with it. So regarding and then colon, Mr. Jack Spencer, full stop, date of birth, colon, and then 10/10/51. So just copy this and use it on your OET and don't worry about it anymore. So lots of good questions today. This is a very commonly messed up subject on the OET writing. So guys, make sure that if you're still having doubts after this session, this is going to be uploaded on YouTube, and you should be able to just revise these things before your exam. I would advise that in the last few minutes before submitting your letters, always revise your letters for spelling mistakes and small and capital letters, full stops and commas, because these are simple things which we don't take very, very seriously, but they're actually quite important on your OET, especially when they're looking at your grammar and when they're looking at your English. So just make sure that you remain clear in where you're using small letters and capital letters. Again, if you want to enroll in our writing checks and speaking checks, please do visit our website, and hopefully you should be able to pass your OET very, very soon. And if you want to come and work with us in the NHS, you're very, very welcome. So we're going to wrap up today's session now. Stay tuned. There's going to be a session by Manoj sir tomorrow on grammar. And if you are on our Telegram group or on our WhatsApp groups already, just keep an eye out for the link for tomorrow's session. Dr. Prashant is going to upload it very, very shortly. So good luck, guys. I hope you keep safe and well and keep studying, and all the best for your upcoming exams.